Welcome back. This is Gateway 101. In today's video, in today's live broadcast, we're going to be talking about arthritis. What is arthritis? And some prevention tip and lifestyle changes that people who are arthritis might put in place to help them live better, to help them live pain free. Okay. Without wasting much of your time, let's dive in. Arthritis is a condition that causes joint pain, stiffness, swelling, and reduced movement. While some type of arthritis can be fully prevented, healthy lifestyle choice can greatly reduce the risk, slow progression, and ease symptoms. Okay, so we are going to talk much and much and much about arthritis. Okay, so we are saying that arthritis is a condition that causes joint pain, stiffness, swelling, and reduced movement. Sometimes the pain can be severe, while some type of arthritis cannot be fully prevented, but healthy lifestyle choice can greatly reduce this pain. Okay, healthy lifestyle can greatly reduce the risk, slowing down progression and ease the symptoms. Okay, so let's go ahead and talk about arthritis prevention tips. How can we prevent arthritis? So this step help prevent your joint and lower your risk. The first thing we're going to be talking about here, don't forget now we're talking about arthritis prevention tips. Okay, and the first step will be maintaining a healthy weight. In other words, obesity is a contributing factor to arthritis. Obesity is one of the major risk factors associated with arthritis. Okay, so extra weight puts stress on your joint. That's just the truth. Extra weight would put stress on your joint, especially the knee, your hip, and your spine. Losing even a small amount of weight reduces joint pressure. Okay? If you're having arthritis and you are overweight, just losing even a small amount, 5 to 10% of your weight, will ease your joint pressure. Okay? Because extra weight do what? Extra weight puts stress on your joint, especially knees, your hip, your spine, spinal cord. Extra weight will put pressure on this on your joint. So losing even a just small amount of weight, 5 to 10% of your weight, will reduce joint pressure. Okay? Don't forget now we're talking about arthritis prevention tips. Okay? So I'm going to say number 1 is maintaining a healthy weight. So 2, stay physically active. Okay? Regular movement keep joint flexible and strong. Regular movement keep joint flexible and strong. And regular physical activity prevents stiffness and muscle weakness. So one of the major tips for arthritis is stay healthy. Do at least 30 minutes of physical activity. You might not need to go to the gym, but if you go to the gym, that would be even better. That would be an extra. But you can stay at home and do a little bit of physical exercise. You can do push-up, you can stretch, you can walk around your neighborhood, you can do biking, dancing, swimming, any kind of physical activity that will keep you engaged, okay, will help prevent stiffness and muscle weakness. We are talking about prevention tips, okay, arthritis prevention tips, things that you can do that will help prevent arthritis. And we said number one, maintain a healthy weight. Number two, stay physically active. And we're saying that regular movement keeps joints flexible and strong. It also prevents stiffness and muscle weakness. 3, protect your joint. Avoid repetitive strain and poor posture. Protect your joint. Avoid repetitive strain and poor body posture. Use proper lifting techniques. This is very, very important. Okay? Use proper lifting techniques. Take breaks during long physical activity. Okay? Stretch. Let's digress a little bit. It's what we call stretch fracture. It's like a tiny fracture, like a hair-like tiny fracture, very, very small. Okay, one of the major causes of stretch fractures is repetitive strain and poor body posture. Okay, and also long physical activity. Those are some of the major causes of stretch fracture. Stretch fracture, like I said, is a hair-like tiny fractures. Okay, so avoid repetitive strain and poor body posture. Use proper lifting techniques and take break during long physical activity. Prevent joint injury. This is also one of the major causes of stretch fractures. Previous fractures that are not properly taken care of will easily develop to stretch fractures. So prevent joint injury. Wear supportive shoes. Use protective guard during sport or heavy work. Treat injury promptly to prevent long-term damage. Okay? 5, manage chronic condition. Control diabetics. Chronic condition like diabetics, high blood pressure, and cholesterol. Manage chronic condition. Control your diabetes, control your high blood pressure, and control your cholesterol. Quit smoking. Smoking increases inflammation and joint damage. We'll talk about this in many of our broadcasts. Nothing good comes from smoking. Here again, we're talking about arthritis, and one of the arthritis prevention tips is to quit smoking. So because smoking increases inflammation and joint damage. Lifestyle tip to manage or reduce arthritis symptoms. We're going to be talking about lifestyle tips, TIPX, to manage or reduce arthritis symptoms. 1. Exercise regularly, low impact. Best option will include walking, swimming, cycling, yoga, stretching. Aim for 30 minutes most day of the week. Okay. A total of 150 minutes of workout a week is perfect. But 30 minutes a day for most of the week will go a long way. Eat an anti-inflammatory diet. Do not forget, we're talking about lifestyle tips to manage or reduce arthritis symptoms. Okay? And we are saying that eat an anti-inflammatory diet. This will include fruits and vegetables, fatty fish such as salmon or sardines, nuts and seeds, whole grain, olive oil. Limit sugary food, fried food, processed food, excessive salt intake. Remember, most of our broadcasts will talk about people will encourage people to pay attention to canned food when they go out to go do their grocery. Pay attention to your canned food. Okay? Pay attention to canned food labels, because most of this food is preserved with excessive sodium. I will say that your daily salt intake should be more than 1,500 to 2,300 milligrams per day. Okay, so pay attention to the label. Okay, stay hydrated. Water helps keep cartilage healthy, and it is also hydration also reduces joint stiffness. So if you want to prevent arthritis, make sure you stay healthy. Drink about at least 2 to 3 gallons of water a day. That will be good. At least maybe a gallon. 2 gallons a day is not bad, but a gallon will be worst case scenario. 1 gallon will be ideal for a day. Okay, because this helps lubricate your joint. Okay, because water keep your cartilage healthy and reduces stiffness. Okay, so get enough rest. Sleep helps the body repair tissues. Okay, so get enough rest. Balance activity with rest. We talked much about that before. A manic stress. Stress worsens inflammation and pain. Okay? If you are stressed, this will worsen inflammation and pain. Okay, so try as much as possible to manage stress. We're going to be talking about stress management in this broadcast. Try deep breathing. Breathe in for breathe in for 4 seconds and out for 6 seconds. Do this 2 to 3 minutes to help reduce stress. Meditation also help reduce stress, or gently stretching. It help reduce stress. Use heat and cold therapy. Heat relaxes stiff joint. Okay, you can use heat and cold therapy. And we are saying that heat relaxes stiff joint. Cold reduces swelling and pain. Okay? Consider supplements with your provider approval. So before you take any supplement to help manage your stress, make sure you contact your healthcare provider. Very important. Okay, because omega-3 fatty acid is one of the supplements to help with arthritis. Vitamin D is another supplement too that helps with arthritis. Calcium help with arthritis. Turmeric, it also helps. So if you want all these supplements, but make sure you consult your healthcare provider. Don't just go, even though most of these things are over the counter, don't just go and buy medication and start treating yourself without proper medical guidance or prescriptions. Okay, because lab need to be drawn before you buy any of these supplements. So your personal care provider need to look at your labs, and he will advise you on what supplements you need, if at all you need any. Okay? When to see a doctor? Let's recap a little bit. Okay? We talked about arthritis. What is arthritis prevention and lifestyle tips is what we're talking about today. And we said that arthritis is a condition that causes joint pain, stiffness, swelling, and reduced movement. While some type of arthritis can be fully prevented, healthy lifestyle choices can greatly reduce the risk, slow progression, and ease symptoms. And we are saying that arthritis prevention tip, that maintaining a healthy weight. Extra weight puts stress on joint, especially your knees, hip, and spine. So losing 5 to 10% of weight, reducing pressure, joint pressure. Stay physically active. I would say that regular movement keep joint flexible and strong. Prevent stiffness and muscle weakness. Excuse me. Prevent weakness. Staying physical active. I would say that for you to stay physically active, you must move regularly, because regular movement keeps joint flexible and strong. It prevents stiffness and muscle weakness. Also protect your joint. Protect your joint. I would say that avoid repetitive strain and poor posture. Okay? Use proper lifting techniques. Take break during long physical activity. Okay? Don't forget now, we're talking about we're talking about arthritis, what's arthritis and prevention tips. Okay, I will say protect your joints. So avoid repetitive strain and poor posture. Use proper lifting techniques. Take break during long physical activity. prevent joint injury. Wear supportive shoes. Use protective gear during sport or heavy work. Treat injury promptly to prevent long-term damage. Okay, we'll see on the tips. Number 5 will be manage your chronic condition. So if you are diabetic, you have high blood pressure, you have high cholesterol, try to manage it. If you want to prevent or manage arthritic symptoms, to prevent arthritis, all these things must be put in place. I will say that quit smoking because smoking increases inflammation and joint damages. Okay, so we also talk about lifestyle tips to manage or reduce arthritic symptoms. I will say exercise regularly, walking, swimming, cycling, yoga, or stretching. Aim for 30 minutes most of the day of the week, or a total of 150 minutes. Would help. I will also talk about eat an anti-inflammatory diet. Okay, this includes fruits and management, fatted fish, salmon, sardines, eat nuts and seeds, eat whole grain, take take moderate olive oil. I also said that limit your sugary food, fried food, processed food, excess salt. So I will also talk about stay hydrated because water help keep cartilage healthy and water reduce joint stiffness. We also said get enough rest. Because sleep help the body repair tissue. So get enough sleep if you want to prevent arthritis. Okay. Balanced activity with rest period. Balanced activity with rest period. Okay. Manage stress. Stress worsens inflammation and pain. Yeah. Stress worsens inflammation and pain. I will say try deep breathing. Take a deep breath. Breathe in for 4 seconds and out for 6 seconds. Do this 1 to 3 minutes. Meditation or gently stretch. Okay. I will say that you can use heat and cold therapy because heat relaxes joint stiffness and cold reduces swelling and pain. And we say that if you want to take supplement for arthritis, this 4 supplement is good, but they got to be prescribed by your healthcare provider. We know that these supplements are over the counter. Don't just go and take this supplement without the guidance of your healthcare provider. Okay, like the omega-3 fatty acid is good for arthritis. Vitamin D is good for arthritis. Calcium is good for arthritis. Turmeric is good for arthritis. But all this got to be prescribed by your healthcare provider because you just don't go and buy this thing without a lab work being done. Okay? So I was saying that if you have arthritis, when to see a doctor? Because we put in place already, we'll be talking about prevention, symptoms, and lifestyle change that you can put in place to help reduce this arthritis pain. Okay, here we're talking about When do you need to see a doctor? You need to see a doctor if persistent joint pain or swelling do not subside. Okay? If you have a joint pain or swelling that do not subside, you need to see a doctor. Okay? You need to see a doctor. Morning stiffness lasting more than 30 minutes. It's an emergency. You need to see a doctor. Difficulty moving or performing daily tasks. You need to see a doctor ASAP. Okay? Early care can prevent joint damage and improve quality of life. Yes, you heard me. Yeah. Don't forget, in Gateway 101, we place so much emphasis on creating health awareness and prevention because we strongly believe that prevention is better than cure. So this is why we give you all these health tips to prevent others illnesses and diseases. Put all these things in place so that you can be better equipped, better informed, and prevent yourself from all this unnecessary illness. Okay? So we strongly say that you need to see your primary care physician ASAP if you have a joint pain or swelling that persisted. Okay? You having morning stiffness lasting more than 30 minutes. You need to see a doctor. Difficulty moving or perform daily tasks. You need to see your doctor. Because early care can prevent joint damage and improve quality of life. Okay? So let's talk about what is arthritis and how does it affect people. How does arthritis affect individuals? How does it affect people? Remember, we said that arthritis is a general term for condition that causes inflammation, pain, and stiffness in the joint. A joint is where two bones meet, like the knee, hip, or fingers. Arthritis can affect people of all ages, though it's more common as people get older. Okay? So I take that again. So arthritis is a general term for condition that causes inflammation, okay, pain, and stiffness in the joint. I will say that a joint is where two bones meet. Joint, this like your knee, your hip, your fingers. Arthritis can affect people of all ages, although it's more common as people get older. Okay? So what happened in arthritis? What really happened in arthritis? When you have arthritis, the tissue in or around a joint become damaged or inflamed. We understand that? We said what happened in arthritis. And we are saying that when you have arthritis, the tissues in or around a joint become damaged or inflamed. So this can lead to pain during movement or even at rest, swelling and tenderness, stiffness, especially in the morning or after resting, reduced range of motion. Okay? Joint deformity over time in some type. Yeah, this we call joint deformity. if it persists for a long time. Common type of arthritis. There are 100 types plus, there are 100 plus types, but the most common including osteoarthritis. Osteoarthritis. That is the most common type of arthritis. It is caused by wear and tears of joint cartilage. Okay, and it's caused by wear and tears of joint cartilage. It's common in your knees area, your hip, hand, and spine. More frequent with aging population, older people, and also common with obesity people or joint injuries. Rheumatoid arthritis, RA, is another type of arthritis. The rheumatoid arthritis, an autoimmune disease. The immune system attacks the joint. Okay? In rheumatoid arthritis, is an autoimmune disease whereby the immune system attacks the joint. It often affects both sides of the body equally, can cause fatigue and affect other organs of the body if not treated or if not properly managed. Let me put it that way. Usually starts between the age of 30 to 60. Yeah. It's common with older people. Gout, G-O-U-T, caused by buildup of uric acid crystal in joint. So you need to stay hydrated a lot. You drink a lot of water. If you're an arthritis patient, drink a lot of water. It will help flush out your uric acid because gout is caused by buildup of uric acid crystal in the joint. Okay, often affect the big toes, sudden severe pain and swelling. Okay, so you need for us to prevent arthritis, you need to drink a lot of fluid. Very important. Sporadic arthritis. Sporadic arthritis occur in some people with sporaditis. Can affect joint, skin, and your nails. How does arthritis affect people? Arthritis can affect daily life in many ways. Okay? Difficulty walking, climbing stairs, or using your hands. Okay? Physical effect. So difficulty in walking, climbing stairs, or using hands. Trouble with daily tasks like dressing or cooking. It can also cause chronic pain and fatigue. Remember, we're talking about how arthritis affects people. And we said that arthritis can affect daily life in many ways. And one of the ways will be difficulty in walking, climbing steps. You can't even climb from your downstairs to upstairs, or climbing from upstairs to downstairs, or using your hands to do a few activities of daily living. Trouble with daily tasks like dressing or cooking. Okay, chronic pain and fatigue. You get tired easily. Emotional and mental effect. Stress, anxiety, or depression due to long-term pain. Here, pain will cause stress. Persistent pain will cause stress. Perpetual pain would cause stress. So, emotional and mental effect of arthritis, such as stress, anxiety, or depression due to perpetual pain or persistent pain due to long-term pain. Sleep problem. You find it difficult to fall asleep. This can cause emotional and mental effect. Okay, so sleep properly. Get 7 to 9 hours of daily sleep. Okay, that will help. Work and lifestyle impact. Reduce ability to walk or exercise. Okay, one of the effect of arthritis will be work or lifestyle impact. I was saying that work and lifestyle impact, this will reduce your ability to walk or exercise. Because if you're in pain, you can exercise. If you are in much pain, you can't do too much physical activity. Okay, arthritis pain or arthritis will limit independence if severe. Rheumatoid arthritis, you can barely use your hands or use your joint depending on the area that is attacked. Because most rheumatoid arthritis is common with older people. If you're around other old people, you will see that those that have rheumatoid arthritis, they can barely use their hand, not even to lace a shoe. Okay, so arthritis affect lifestyle. Okay, it may limit independence if severe. Okay, who is at risk for arthritis? We're saying that older adult. Remember, we said that arthritis attacks every age, but it's mostly common with older adult. So older adult, older people, they are at risk for arthritis. People with family history of arthritis, this will be genetic. Okay, they are at risk. Grandparents have arthritis, great-great-parents have, present parents have, so you are at risk because you run in your family lineage. Those who are overweight, remember we said it before that overweight is a risk factor for arthritis, and just losing 5 to 10% of body weight can go a long way to ease arthritis pain or preventing arthritis. Past joint injury. If you have injury, let's say in your kneecap before or your ankle, you have injury in your waist, you strain your waist, okay, this will put you at risk for arthritis. Certain occupation or repetitive movement, yeah, mostly construction workers, they do a lot of manpower. They use a lot of strength, and do a lot of lifting too. So certain occupation or repetitive movement, you're at risk for arthritis. For arthritis. Okay. Can arthritis be managed? The answer is yes. It can be managed, and it can be managed effectively too. Okay. Why many type of arthritis can be cured? Symptoms can often be managed, can be well managed. Okay. Why many type of arthritis cannot be cured? I mean to say, I'm sorry. Why many type of arthritis cannot be cured? Symptoms can often be well managed. Okay. Regular gentle exercise. Arthritis can be managed by doing regular gentle exercise. Healthy weight management. We said this before that just losing 5 to 10% of body weight reduction would help. So healthy weight management. would help manage arthritis. Medication, pain reliever, or anti-inflammatory drugs. You got to talk to your doctors if you want to be on medication for arthritis. But let that already be your last resort. Let that be your last choice. Okay. Do a lifestyle change, exercise regularly, eat healthy, quit smoking if you're a smoker. So let medication be your last resort. And do not just take medication because most medications are over the counter. You must talk to your healthcare provider. Okay, very important. Physical therapy can help manage arthritis. Balanced diet and lifestyle changes can also help greatly manage arthritis. Okay, so let's recap. So we started by saying that arthritis is a general term for condition that causes inflammatory pain and stiffness in the joint. A joint is where two bones meet, like the knee, your hip, or your finger. Arthritis can affect people of all ages, although it's more common as people get older. We said that before. Okay? So, what happens in arthritis? And we said that when you have arthritis, the tissue in or around a joint become damaged or inflamed. So this can lead to what? This can lead to pain during movement or even at rest. Swelling and tenderness will occur. Excuse me. Stiffness, especially in the morning or after resting. Reduce range of movement. This might cause joint deformity over time if it stays too long. I will also talk about common type of arthritis. I will say that there are over 100 plus type of arthritis, but the most common one would be osteoarthritis. This is the most common type of arthritis caused by wear and tear of joint cartilage. Okay, this is common in your knee area, your hip area, lower back, hand, and spine. Okay. I will say that more frequent with aging, talking about osteoarthritis, that is more frequent with aging as you get older, obesity, or joint injury. Rheumatoid arthritis, when we talk about, I will say that rheumatoid arthritis is an immune disease. The immune system attacks the joint, often affect both sides of the body equally. I will say that it can cause fatigue and affect other organs of your body. Usually started between age 30 to 60, rheumatoid arthritis. Most older people suffer for it. What about gout? Gout is caused by buildup of uric acid crystal in a joint. Joint can be so painful if you have gout. Often affect the big toe. Yeah, this will affect the big gout will affect the big toe. Suddenly severe pain and swelling if you have gout. Sporadic arthritis occur in some people with psoriasis. Can affect joint, skin, and your nails. Okay. How arthritis affect people? I would say that arthritis can affect daily life in many ways. And I will also say that physical effect, we say difficulty walking, climbing stairs, or using your hands. Trouble with daily tasks like dressing or cooking. Yeah, mostly with rheumatoid arthritis, if they affect your hands, you can barely do activities of daily living. Okay, don't forget now we're talking about how arthritis affects people. I was saying that my physical effect will be difficulty walking, climbing step, or using hands. Trouble with daily tasks like dressing or cooking, mostly common in rheumatoid arthritis. Chronic pain and fatigue, persistent pain that never go away. Emotional and mental effect, I would say that stress, anxiety, or depression due to long-term pain. Then sleep problem, difficulty falling asleep or not sleeping at all will cause emotional and mental effect. Okay, I would say work and lifestyle impact of arthritis. How does arthritis work and impact your daily lifestyle? I would say it reduces your ability to walk or exercise because you are so much in pain. You cannot do much exercise if you are in pain. So it may actually it may limit your independence if severe. We also said that who is at risk for arthritis, and we said that it's most arthritis attack people of all age, but it's most common with older people. As you get older, arthritis attack older adult. People with family history of arthritis, genetic. You have grandparents who have arthritis, you have great grandparents arthritis, your parents have arthritis, and it run in your family, it's run in your lineage, it becomes genetic. Okay, so those who are overweight can also be affected with arthritis. Okay, weight is a major contributing factor to arthritis. So we struggle and encourage you to reduce your weight 5 to 10% of weight loss as you gradually walk it down will be of good courage. Okay, so don't forget we're talking about who is at risk. I would say those who are overweight, they are at risk for arthritis. Older adult, they are at risk. People with family history, they are at risk. Past joint injury, they are at risk for arthritis. Yeah, mostly these athletics who have fractures, excessive strain of the bone mass, the bone marrow cartilage, and past injury. I would say that one of the major causes of stress fracture is repetitive strain on your joint. Okay, so past joint injury, you are at risk for arthritis. Certain occupation or repetitive movement, I would say that people who work constructions, they do a lot of lifting, a lot of physical, a lot of movement. They are at risk for arthritis. Can arthritis be managed? I would say yes, that it can be managed. Even why many types of arthritis cannot be cured, but arthritis on its own can be managed. Symptoms can often be well managed with regular, gentle exercise, healthy weight management. Okay, remember I was saying that obesity is a contributing factor to arthritis. So, healthy weight management. Medication, I would say that let this be your last choice, last resort. And that if you must take medication, you must consult your primary care physician. Very important. Because medication, pain reliever, or anti-inflammatory drugs will help ease pain. But let that be your last resort. Balanced diet and lifestyle changes. Yeah. This can be well used to manage arthritis. Okay. So let's look a little bit about let's talk about a little bit on arthritis prevention tip. Okay, arthritis, like we said before, is a condition that causes joint pain, stiffness, swelling, and reduced movement. While some type of arthritis cannot be fully prevented, healthy lifestyle choices can greatly reduce the risk, slow progression, and ease symptoms. Okay, so we are saying that arthritis prevention tip, I would say that this step put in place will help prevent arthritis. Remember, in Gateway 101, for those of you who have been following us, we strongly believe that prevention is better than cure. So, maintaining a healthy weight will help prevent arthritis. Extra weight puts stress, because extra weight will put stress on your joint, especially your knee, your hip, your back, and your spine. Your waist too, because most people suffer a lot of weight. Mostly if you don't know how to lift properly, you will hurt your waist. Losing even a small amount of weight reduces joint pressure. Okay? I will say that you should stay physically active. Yeah? Stay physically active if you want to prevent arthritis. Okay? Regular movement keeps joints flexible and strong, prevents stiffness and muscle weakness. Protect your joint, avoid repetitive strain and poor posture. Okay, you must protect your joint if you want to prevent arthritis. So you must maintain a good posture, body posture. Avoid repetitive strain and poor posture. Use proper lifting techniques. Don't ever lose lift with your waist. Okay, most weight pain can be associated with poor lifting techniques. Not using proper lifting techniques would put strain on your back and your weight and on your waist. Okay, so we have a video that you can actually watch on how to lift properly. Okay, don't forget we place more emphasis on prevention. Okay, if you hurt your back, if not properly treated, this thing can actually remain with you for life. Okay, you put unnecessary strain in your waist, you will suffer a waist pain through your lifetime. You'll be on different type of medication. As soon as the medication wear out, here come the pain again. You're using cold therapy, hot therapy, the pain still persists. So most people that are actually suffering from back and waist pain is due to poor lifting techniques. Okay? And don't forget to take break during long physical activity. Okay, mostly those construction workers that carry a lot of heavy load. Don't just walk all day till you break down. Walk, take a break. Okay, take break during long physical activity. Very important. Or you go to the gym all day from morning to night. You are in the gym. No, it doesn't work that way. Take a break. Okay. We're talking about how to prevent arthritis prevention tip. This is what we're talking about now. So prevent joint injury. Prevent joint injury. Wear supportive shoes. Okay. Use protective gear during sport or heavy work. Treat injury promptly to prevent long-term damage. Okay. Manage chronic condition. Control your diabetics. If you have some chronic conditions such as diabetes, high blood pressure, and high cholesterol. So control your diabetes properly, control your blood pressure, control your cholesterol. I also say that you should quit smoking because smoking increases inflammation and joint damage. Okay? So lifestyle tip to manage or reduce arthritis symptoms. A simple lifestyle tips to help manage or to help reduce arthritis symptoms. One would be regular exercise. Exercise regularly, low impact. So the best option will include walking around your neighborhood, go to the park to walk around, swimming, cycling, yoga, or gently stretching. And we said you should do at least 30 minutes most day of the week. 150 minutes of exercise for a week would be ideal. Okay? So eat an anti-inflammatory diet. Another arthritis prevention tip would be to eat an anti-inflammatory diet. This will include fruits and vegetables, fatty fish such as salmon, sardines, nuts, and seeds, whole grain, olive oil. Okay? So I will also say that one of the arthritis prevention tips would be limit sugary food. Okay? Like limit fried food, processed food, excessive salt, or excess salt. Okay? We also say that you should stay hydrated. Stay hydrated. Very important. Stay hydrated. Water helps keep cartilage healthy, and water also reduces joint stiffness. So stay hydrated. Get enough rest. Sleep helps the body repair tissues. So balance activity with rest period, very important. Okay? Stress management. Stress worsens inflammation and pain. So manage your stress. Okay? Keep deep breathing. Breathe in for 4 seconds and out for 6 seconds. Okay? Yeah, deep breathing, meditation, or gentle stretching. This will help prevent arthritis. Okay? You can also use heat or cold therapy because heat relaxes the stiff joint and cold reducing swelling and pain. Okay, so if you consider taking supplement, you must seek your doctor approval. Know that most supplements are over the counter OTC, but that does not mean you can just go to the stores to grab the stuff. Make sure you seek your doctor approval. Such as supplements like omega-3 fatty acid is good for arthritis, to help manage arthritis. Vitamin D is also good to help manage arthritis. Calcium is good. Turmeric, curcumin is also good to help manage arthritis. Okay? So, when to see a doctor? I would say that persistent joint pain or swelling, morning stiffness, lasting more than 30 minutes, make sure you run to your doctor. Okay? Difficulty moving or performing daily activity, make sure you see your doctor. Okay? Early care can prevent joint damage and improve quality of life. Okay, so seek redress immediately. If your pain is persistent, you have a persistent joint pain or swelling, make sure you seek medical help. You have morning stiffness lasting more than 30 minutes, please seek medical help. Difficulty moving or performing daily tasks, please see your medical provider. Okay, so let's also recap on arthritis prevention tip for easy understanding and retention. Okay, so arthritis, like we said, is a condition that causes joint pain, stiffness, swelling, and reduces movement. While some type of arthritis cannot be fully prevented, life's lifestyle choice can greatly reduce the risk, slow progression, and ease symptoms. I will say that arthritis prevention tip will say that this tip help protect your joint and lower your risk. Tips such as maintaining a healthy weight, because extra weight puts stress on joint, especially knee, hip, and your spine. I would say that losing just 5 to 10% of your weight, um, will reduce joint pressure. Okay, joint pressure, because extra weight put pressure on your joint. Extra weight puts stress on your joint. I would say that stay physically active. Regular movement keep joint flexible and strong. Okay, stay physically active. Prevent stiffness and muscle weakness. I would say that um, physical activity will help prevent stiffness and muscle weakness. I would say that protect your joint. Avoid repetitive strain and poor body posture. Okay, I would say use proper lifting techniques, because most back pain and waist pain can be associated with poor lifting techniques. Okay, so take break during long physical activity. Yeah, so prevent joint injury. So wear supportive shoes. Uh, Protect something. Wear weight support and all that stuff. Okay, use protective gear during sport or heavy work. Treat injury promptly to prevent long-term damage. Okay, so manage chronic condition. We say control your diabetes, your high blood pressure, your bad cholesterol. I also said that you should quit smoking, because smoking increases inflammation and joint damage. Okay, well, we said lifestyle tip to manage or reduce arthritis symptoms. We said exercise regularly. Okay, best option would be walking around, swimming, cycling, yoga, or gently stretching. Aim for 30 minutes most day of the week. So we also said that you should eat an anti-inflammatory diet, such as your veggies, fruits, fatty fish like salmon, sardines, nuts and seed, whole grain, olive oil. Okay, I would say you should limit your sugary food, fried food, processed food, excessive salt. Okay, I would say you must stay hydrated. Yeah, stay hydrated, very important. Water helps keep cartilage healthy, reduces joint stiffness. We also said that you should get enough rest, because sleep help the body repair tissues. Sleep help the body repair tissues, stay healthy. Balance activities, okay, with rest. Manage stress. Stress will worsen inflammation and pain. Try deep breathing, meditation, or gently stretching. Okay. Use the heat and cold therapy, because heat relaxes stiffness and cold reduces swelling and pain. So consider supplement. If you consider supplements, but be from your doctor to approve your supplements, such daily supplement like omega-3 fatty acid and vitamin D, calcium, and turmeric. Okay, when to see your doctor? I would say that see your doctor immediately if you have a persistent joint pain or swelling. Seek medical help when you have a morning stiffness lasting more than 30 minutes, difficulty moving or performing daily tasks. This is our medical emergency, please. Okay, so these are the arthritis prevention tips that we give you today. Okay, so we will be broadcasting this again in the evening so that those of you who missed this afternoon broadcast can connect to the evening. Okay, so this is Gateway 101 where we also have videos on how to reduce arthritis pain using home remedy, a very, very effective, simple home remedy that will cost you nothing. So go to our social channel media. Our YouTube channel, we'll have it on our YouTube channels. It's called Simple Home Remedy to help alleviate arthritis pain. It is a very, very simple home remedy that you can use to reduce arthritis pain. Okay, it will help you reduce arthritis. It reduces morning stiffness and persistent pain or swelling. It's a very, very good remedy. You can look at the comment that people who have tried it or who have used it commenting it. So the product is out there. It will not cost you nothing. Okay, it's a very simple home remedy with items that you already have in your kitchen, but you don't know what they can actually do to your body if you properly apply them. So go to our YouTube channel and watch and see. Okay, so this is Gateway 101. Thank you for watching. We'll see you again this evening. Okay, bye for now.